settling in to a position that's comfortable, closing your eyes if that feels okay. There's always the option of opening your eyes if you prefer. Having them closed, there's less visual distraction. And this meditation, called body scan, can be done either sitting or lying. If you have space, often it's a meditation that's nice to do lying on your back, on perhaps a carpet or a couch or a bed or a yoga mat, or it can just as well be done sitting. So starting off by tuning into your body overall. Notice how your body is feeling right now. The general condition of your body. So notice if you're feeling totally comfortable, or if there's any aches or pains or discomfort anywhere. Or even if there is some discomfort, notice where that is, and also notice all the places in your body that are not having discomfort. And if you need to, you can adjust your position if you feel you're not going to be comfortable being still in this position for a while, making any adjustments you need to, so that you can sit in a way that, or lie down in a way that's going to be comfortable for the next little while. And notice that you're breathing, just by noticing the sensations in your body as you breathe in and as you breathe out. So whether it's the belly moving in and out, or the chest rising and falling, or the flow of air at your nostrils. Just noticing the sensations with each breath. And next, I'll invite you to just bring your attention right down into the toes of your left foot. So your awareness is like a spotlight that you're shining in that one area. And just being aware of any sensations that are present in the toes of your left foot. Noticing if you feel the toes touching each other, or you might feel your toes touching your sock or shoe. Or if you don't feel anything at all, then that's okay too. Just notice the lack of sensation. So the aim is not to be thinking about your body, but just to be feeling the sensations. If your mind wanders off, when you notice that's happened, just come back. So moving now to the bottom of the left foot. Just feeling any sensations that are there around the sole or the instep of the foot. Just experiencing it as it is. And then shifting your focus to the heel of the left foot, the back of the heel, the bottom, the sides, the ankle as well. There might be an area of pressure if the ankle is resting against the floor. And then bring your attention to the top of your foot. And then expanding this awareness now to just feel your entire left foot. However it is, moment to moment. Just being in touch with the sensations. Feeling the position the foot's in. Feeling any points of contact or touch, pressure, or perhaps temperature, pulsations, tingling. Just aware of whatever's going on in that area. And then for a few breaths, imagining that you're breathing into your foot and out from your foot. Breathing in a slow breath and imagining the air moving in, and imagining that it's moving down your body, down your leg, right into your foot. And then as you breathe out, imagining that the breath is coming back up again, up your leg and body and out your nose again. Or if you prefer, you could imagine it as your attention or your energy sweeping down your body into your foot and coming back up again. And then we can let go, kind of let your attention dissolve from your foot, and now bringing your attention to the area of the left shin and calf. So feeling whatever sensations are there in the lower leg, between the ankle and the knee. Sensations on the surface of the skin or perhaps in the muscles. And then shifting your focus from here right into the left knee. Just feeling whatever sensations are there, perhaps in the front of the knee, around the kneecap, the back of the knee, the whole inside of the knee. And then moving your focus to the left thigh. So that whole large area of the leg from the knee to the hip, the front of the thigh, the back, the sides. Aware of any contact or touch, or sensations in the muscles. And then expanding your awareness, kind of widening the spotlight to take in the entire left leg. Just feeling the left leg as a whole, from the hip right down to the toes. Feeling the position of your leg, all the various sensations. And then breathing into your leg and out from your leg for a few breaths. Imagining your breath moving in and traveling down, filling the leg, and then coming back up as you breathe out. And letting your attention dissolve, kind of letting go from the left leg, and moving your focus down into the toes of your right foot. Just experiencing whatever sensations are there. Perhaps feeling the big toe, or the baby toe, the toes in between. if your mind wanders off at times, remembering it's natural for that to happen. Your mind may keep producing thoughts, and sometimes you get sort of caught up in them. So anytime you notice that's happened, that moment of noticing is another moment of being mindful. And when you realize you were lost in thoughts and not connected with your body, then just start over. Just come back to your body, to wherever we're focusing on. In this case, the toes of the right foot. Moving the focus now to the bottom of the right foot, the sole, the instep. And moving to the right heel. Noticing if there's any area of pressure where the heel is resting against the floor. Using this time as an opportunity to, in a sense, appreciate your body, all that it does for you, the complex workings of the human body. So bringing some patient, caring attention to each area. And also using this as a time to just be. Bringing your focus to the top of the right foot, and just noticing any sensations there. And then expanding the awareness to fill your entire right foot. Noticing full range of sensation, the whole sensory field of the foot. And then breathing into your foot and out from your foot for a few breaths. And now shifting your attention, moving it to the area of the right shin and calf. Noticing any contact with the skin, any other sensations on the surface or inside that part of the leg. And then moving your attention into your right knee, exploring any sensations there. Around the kneecap, or the back of the knee, or inside the knee. And then bring your attention to the right thigh. So the whole area of the leg between the knee and the hip. All around the thigh, front, back, sides. Just directly experiencing the sensations. So our aim in doing this is not to be sort of thinking about the body, but more to be feeling it, to just be directly experiencing the sensations. Expanding now to feel the entire right leg. So having scanned through each area now, just feeling the right leg as a whole, and breathing into it and out from it, if you like, for a few breaths. Now bringing your attention to the area of your pelvis. So the buttocks, the groin, hips, the whole pelvic area. Perhaps noticing pressure or contact with whatever you're sitting or lying on. And then bring your attention to the area of your lower back. Noticing any sensations in that area. And shifting upward to the middle and upper areas of the back. Around the shoulder blades, back of the rib cage, back of the spine. Perhaps noticing if you feel any movement in the upper back as you breathe. And then bringing your attention around to the abdomen, to your belly. Noticing here if there's any movement happening as you breathe. You might be able to feel the belly expanding outward a little as you inhale, and then deflating as you exhale. Noticing any sensations there on the surface of the skin, the muscles underneath, or even inside the abdomen. You might feel sensations from your digestive tract or from other organs in the abdomen. And then bring your attention up to your chest. Noticing any movement of the chest as you breathe. Perhaps noticing if you feel your heart beating inside your chest. And now moving your attention, bring your focus right down to the fingers of your left hand. See if you can feel the thumb and each finger individually, even without moving them. So noticing as well, perhaps that the sensations are typically more vivid, stronger in this area of the body. The fingers have a lot of nerve endings. Notice sensations perhaps at the fingertips, or in the front or back or sides of each finger. You might feel some touch or temperature, or the feeling of your blood pumping in the fingers, or tingling or other sensations. And maybe now including the palm and the back of the left hand as well, and the wrist. So really feeling into your entire left hand, and then breathing into it and out from it for a few breaths. And shifting your focus, moving your attention to the left forearm. So the whole area of the left arm from the wrist up to the elbow, including the whole elbow joint itself. And then bring your focus to the left upper arm. So from the elbow to the shoulder. And then moving your attention from here down to the fingers of your right hand. Feeling the thumb, feeling each individual finger. Experiencing the whole range of sensations in that area. And then including the sensations in the palm and the back of the hand as well, and the wrist. So that you feel your entire right hand. And then breathing into it and out from it for a few breaths. Now shifting your attention to the right forearm, so from the wrist to the elbow, including the whole area of the elbow. Just noticing any contact or touch, if it's resting against anything, or perhaps even your clothing against your skin, or any other sensations. Noticing now the area of the upper arm, so the right arm from the elbow to the shoulder. And then shifting again, now moving up to the area of your neck. Feeling whatever sensations are there, front of the neck, the back, the sides, on the surface or inside your neck. And then bringing your attention up to your face, starting with the chin and lower jaw. Experiencing sensations in that area. And then moving your attention to the area of your mouth. Just feeling it, the cheeks, lips, tongue, teeth and gums, the whole inside of your mouth. And then shifting your attention up to your nose, feeling the nose itself, and perhaps feeling sensations of air moving in and out of the nostrils. Perhaps even noticing if you feel the air flowing more strongly in one nostril versus the other. And then bringing your attention up to your eyes. Feeling the eyes, the eyelids, eyebrows. And also noticing, even if your eyes are closed, if you can detect any light, color, or shapes. Then bring your attention up to your forehead and temples, especially noticing if there's any tension there. And shifting your attention to your ears, feeling the ears, and then also noticing the experience of sound entering your ears. Connecting briefly with the sense of hearing. Noticing how many different sounds your ears are picking up. And then moving your attention to the top of your head. Feeling any sensations there on the skull, scalp, and hair. The top all the way to the back of the head. And expanding this awareness to include your entire head and face, as if you're feeling it from the inside out. And expanding further to now also include the rest of your body. So having scanned through each part of the body, now resting in awareness of the body as a whole, from head to toe. Feeling sensory experiences of the body, and including the sensations of breathing. And continuing this connection with your breath and your body until you hear the bell ring. And perhaps even after the bell is finished, after you conclude the meditation, See if you can be connected with your body even after you start moving, you change position. And of course, you can reconnect with your body in the same way anytime throughout the day.